Hi, I'm Mark Rosa, student physical therapist, talking on behalf of myself and my partner, Joel Whitman, also a student physical therapist. And today we're presenting the top 3 exercises for targeting the glute muscles without overactivation of the TFL. And this is important because overactivation of the TFL can lead to knee pathology or chronic hip pathology. And here are the exercises. Thank you and enjoy.
Our first exercise is a clam in sideline. Patients can have the affected leg on top. The feet and back are going to be pressed against the wall. The hip is at a 45-degree angle, and the knees are bent at a 90-degree angle. The TheraBand's tied around the thigh, so there's no slack at the bottom. And the patient will abduct the hip until it reaches 30 degrees of abduction before returning to the original position. The time for concentric contraction will be 1 second, and the eccentric contraction will be 2 seconds. The patient will have a 3-second hold at the top, and then slowly lower.
Okay, next we have a unilateral bridge. We'll start with the patient in a unilateral hook lying position. So he'll start supine with the knee bent. The opposite leg will be straight, and the patient will raise with a 1-second concentric up till his knee is at 90 degrees of flexion. The patient will hold it up at the top for about 3 seconds, and then we'll slowly lower for a 2-second count. We'll do 10 to 15 reps of this for 30 reps total.
There we go. Our final exercise is a side step. The starting position is the patient will be in 90 degrees of hip flexion and knee flexion. The legs will be slightly apart, slightly abducted, and the toes will be turned out at a 15-degree angle. The patient steps 50% of the length of the distance between the feet on each step. 2 steps are performed to each side, and then 2 steps return into the original position.